Hey everybody, it's Crystal and Julie back again with video number 2 regarding pulmonary hypertension awareness. Again, if you hadn't followed us for our first video, we have been going through just kind of through the eyes of patients. Julie and I both have pulmonary hypertension, and we just want to bring awareness to this disease. It is a progressive disease. There's no known cure. And we kind of talked a little bit last time about how it affects everybody different, how there are different groups. And so we just kind of wanted to make a few videos just to bring awareness to people who don't have this disease, and also just to talk to some of our fellow PHers, because we just want everybody to know how different we all are. And we've not met many of you, so we just kind of wanted to do these videos to, come together maybe. So.
All right. I hope you enjoy. So just to kind of recap a little, or go into a little bit more depth, pulmonary hypertension is high blood pressure in your lungs, not in the rest of your body. So when you get your blood pressure taken, that's not what we're talking about. That is normal hypertension, just normal blood pressure, high blood pressure that you get a diagnosis from your doctor. So what this does is it makes it hard for our heart to pump blood to our lungs to get oxygenated and then to get circulated around the rest of our body. So this makes us usually short of breath. There's some other symptoms though. Chest pain, I think I've heard. I don't get a lot of chest pain, do you?
Not anymore. When I was younger, before I started meds, I got a lot of chest pain. Yeah.
Heart palpitations, I get those occasionally, but it's not usually anything too bad. What are some of the other symptoms?
Feeling faint, lightheadedness, dizziness. I get that quite often.
I used to pass out a lot before I was on my IV medications.
Yeah. And a lot of the medications that we're on also cause some lightheadedness, and we'll go into that too. We're gonna kind of go through our meds again, and some of the side effects from that, because we've seen a lot of people on the Facebook groups that we're on asking questions. New people who have been diagnosed are having questions about some of the meds that they're starting on, and things like that. So we'll go through that, and then we're going to talk about kind of our day-to-day life too, because that is a big difference, between patients too. So I will start with kind of my day-to-day life. I know I've seen a lot of people ask, how do you remember to take your meds? Like, where do you keep your meds? What type of system do you use? I have this handy dandy little knapsack thing, and I keep it literally on the head of my bed. I hook it there. That way I remember to take my meds before my feet hit the floor. So all my meds just go in this bag, except for my inhaler. So we talked last time about medications, and I completely forgot the most important one, I would say, which is Summit. I don't know if you can see that, which is what Julie is on also. This is 10 milligram tablets. This is different from the Tracleer, although it's kind of in the same category.
From what I understand, it's like 10 times more powerful than the Tracleer. Which
I don't notice the difference.
I don't either.
Yeah.
No. Some people, though, they take it and they feel amazing.
Yeah.
For us, it's just been kind of the same.
Yeah.
But the purpose of this medication is to vasodilate. I think the purpose of all of our medications is to vasodilate, allow for easier blood passage, and which in turn makes it easier for us to breathe,
right,
and go on with life.
Yeah, but this is different than Tracleer because it's only once a day. The Tracleer you have to take twice a day, so this is just once a day, which is nice.
And you don't have to get your liver panel every month.
Yeah, you don't have to get liver panels or pregnancy tests, I don't think. Do you?
The pregnancy test, yes, you still do.
I don't have to get those.
I can't remember if that's because I'm on Remodulin or if it's because of that. I think it's because of this.
Okay.
But yeah, you still have to get your pregnancy test.
Okay. We will go into the whole pregnancy thing later, because that is super, super important with this disease to discuss. But so anyways, so my other medication is sildenafil.
Let me back up.
Can you see that?
Do you have any side effects from the Summit?
I didn't notice any right away. The thing with all these drugs, they cause side effects just like any other medication. It's kind of always that, catch-22, like each med's going to cause, something else, so you take something else for something else. I didn't really notice anything with this one.
Now, did you notice side effects when you started Tracleer?
Yes, I had diarrhea all the time. And that's another thing with these medications. They cause some of the symptoms. Like I said, you need additional medications for those symptoms. But these are a lifeline, so I'm fine with taking other medications for these.
Or you just know to find a close bathroom. Always be close to a bathroom.
Yeah. Did you have symptoms with this?
I can't remember. So when I first started Tracleer, since those are so similar, I feel like the symptom or the side effect profile would be similar.
Right.
When I started Tracleer, I started that with a bunch of other medications and then my Remodulin. But I think I remember when I started the medications, I got a lot of
Jaw pain.
Oh,
yeah.
When I would take my first bite, it would be like I ate something really sour right back in here, and I would have to go.
Now that you say that,
until
I
it
think
passed. And then again with I don't know why, but it just gets your GI tract all. It's like hypermobile.
Yeah.
And when I first started medications, I would take probably 5 bites into my meal, and I'd have to run to the bathroom because I had to go number 2.
Ditto.
And at the time, I just started dating the guy that I was seeing, and we were going out to dinner with his mom a lot, and like something that kind of went through my head was, oh my gosh, does she think I'm bulimic? Because I'm constantly running to the bathroom in the middle of a meal. I would sit down at a restaurant and probably get up about 3 times to go to the bathroom.
Yep.
But the longer that I've been on it, the better that is. And I think actually, you know what? Since switching to Up Summit, I feel like my stools are more solid. Sorry if that's TMI.
I know, it is gross, but it's something you gotta deal with.
It's just kind of my life. But I've noticed that they're just it's a lot more manageable.
That's good. Okay, so this one is the sildenafil that I talked about last time, which is Revatio, and which is the also known as Viagra. So this, I make sure my husband doesn't get. I'm just kidding, he doesn't. This is too expensive.
You're just kidding, so he does get to it?
No, he doesn't get to it.
Oh, okay. Just thought I'd clarify.
I'm just saying, this is too expensive. He knows this is like liquid gold, or not liquid gold. I guess it would be gold pills. I don't know, but yeah, he doesn't touch this.
I used to be on that, and then the biggest side effect with that was, for me,
Blood pressure.
I had huge headaches, bad headaches, like migrainous headaches daily. And then one day, I do not recommend doing this because my physician did not tell me to stop taking it, but they were so bad that I just stopped taking it. And when I went for my appointment, I just said, hey, I've stopped taking it. I just can't do it anymore. And then they asked me how I felt, and I said, I feel the same. So that might be something that, you know, as this progresses, because as we said, this is a progressive disease, the medications that we're on are to kind of keep things at bay, but it does progress despite the medications we're on.
Right.
So I may end up back on it at some point in my life. I hope not. But usually with time, though, those symptoms tend to get better, or the side effects, I should say.
For those of you that are watching that have been newly diagnosed, that's something I just really want to make you well aware of. You may go through 3 or 4 medications before your doctor finds kind of your sweet spot. Try not to get frustrated with that. I know this is already a frustrating and heartbreaking disease because it is completely life-changing. Your world kind of flips upside down, especially if you were completely healthy before. And while these meds aren't going to cure us, they definitely do relieve the symptoms, and they do give you a better quality of life. So don't get frustrated if you've got to try different things, because you will eventually find something that works for you. So I started on the Tracleer, which I had talked about in the last video. And then this is the second one that they added when I was working and I started feeling bad when I moved back to Ohio. This gave me that new oomph and I was good to go. I was working as a nurse at Cleveland Clinic. The job was very taxing. I was running my butt off, didn't get a lot of breaks. And this got me through my shift. So this addition was wonderful for the time being. Several years went by, and then I started kind of declining again, and we started talking about adding another medication, which again just means the disease is progressing, and that's just par for the course.
And if we didn't say already, there is no cure.
Yeah, there's not.
Can lead to lung transplants, heart transplants, or both, depending on how much damage has been done.
Yeah, and obviously it can lead to death, and we've seen, people die from this disease, and it sucks. It sucks. So this is my other pH drug. It's called Tyvaso, and this is my lifeline, like her pump is. Like, this is like a step below a pump. The inhaleds are. So they come in little foil packets like that, and they're just little, yeah, Vanna White. They're just little ampules like that, almost like a nebulizer for asthma that asthma patients use. This is the actual nebulizer. Tyvaso has their name nice and big there.
You gotta market this awesome pH.
Yes, make money off of us. So there's just some settings here. You turn it on, you plug it into the wall, turn it on, and then every couple of seconds you take a breath out of the mouthpiece. And this is also one of those medications that you titrate up. A lot of these medications are medications that you have to titrate. Like Julie's pump, she didn't start at the dose she's at now. You have to titrate up and do it safely. So this is another one of those medications. When I first started it, I was on 3 breaths every, it was 4 times a day. Now I'm up to 9 breaths 4 times a day, which sucks, but it's better than...
Did you just say 9 times a day?
9 breaths 4 times a day. That's what I said.
No, I 4 times a day. Just kind of like, I was listening, but then I wasn't at the same time, and then I was like, what? But I mean, for any of you that have a day, a job, how often, but I mean, how practical is it for you to take a break and...
This is better than the Ventavis. So this one, I do it in the morning. I do it in like the afternoonish. I do it in like the early evening around like dinner time, and then I do it before I go to bed. So, I mean, it's quick. It doesn't take like 10 minutes to do. It takes like, I don't know, 3 or 4 minutes, if that. So, but if I skip this or I don't take it, I do notice like throughout the day if I skip a treatment or something. But when I take this, it literally is like a breath of fresh air, and I almost feel like I could run. Almost.
Now, do you carry that around with you?
I don't. I keep this plugged in my wall. I actually keep it in my bathroom. They do make like a car charger type thing for this. And then they also make different plugs so that if you're in another country or something where you don't have like the plugs like we have, they have different plugs for these. So it makes it available. And then these are the other 2 medications I take, which this is metoprolol. This just helps me with heart palpitations. I just started this a couple of years ago. I never really noticed them much, and I don't know if it's because of the medications. I don't know if it's just part of the disease process. So I just started this one. It does help. I take it in the morning with, the rest of my meds.
Does that just help with your palpitations, or does that help you with the overall pH, you think?
Just the palpitations. I mean, that's the main reason they put me on it. But
now,
yes.
were you getting short of breath with your palpitations? Were you getting dizzy with them?
No dizziness, but I would get that like, where it would like take my breath away. Yeah. It was noticeable enough that I, was uncomfortable. But I didn't pass out or anything. And then this one is diphenoxylate atropine, aka Lamodal. And this is a controlled substance, which is so bizarre to me because I don't know why anybody would want to take this. But this is for chronic diarrhea. This and this are my 2 things that I could not live without, because if I don't take this, I can't eat because I'll be in the bathroom all day with stomach pains. It's horrible. So if I run out of this, I'm stuck in bed. I don't do anything. I can't even drink. So that's that. So those are my medications. Should I go into my day-to-day, or do you want to do your meds?
I was going to do my meds.
Okay.
Mine, I'll just use your auto since we're on the same line. Yeah. I take the Opsummit, and that's, again, just once a day. And then my only other med is the Remodulin. So that is my medicine that's mixed in. I have to mix, and it goes in my pump. This is much smaller than the pump I started out on. The pump I started out on was the CAD Legacy. This is the Chrono 5, which I think they might even be developing a smaller pump.
When I was on it, it was like this big. I had to carry it in a pouch. It was
awful. Yeah, and then they said, oh, well, you can easily conceal it underneath a sweater. That's bullshit. You cannot easily conceal it underneath a sweater. Now, this one is actually a little easier to conceal, and I will show you my pouch. So I have this.
It just looks like you're carrying mace all the time.
But people think that it's a cell phone.
Oh, yeah.
So here, I'll demonstrate here. La, 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 la. And then I kind of just, this cord is really long. And I usually just wrap it around. And then...
And don't get any kinks in it.
No, like if I'm wearing leggings, so sometimes I can stick it in like that.
Oh, yeah, that's a good idea.
And then you can't really see it. I feel like for the most part, people don't really notice it a whole lot.
Right.
But so when I get our medications, I guess we should talk about
how we get them?
Shipped from
a specialty pharmacy.
A specialty pharmacy, yes. So this is not something you can just go to CVS and fill. But it's kind of nice. I mean, we call in. We were just talking about this before the video.
Should we talk about this?
Briefly.
Okay, so raise your hand if you have a Credo or CVS Caremark and you're on the phone for like 12 hours ordering your medications. Like, that is the worst.
I was on with Credo and then I switched to CVS Specialty. And I think CVS is very, very well streamlined. I am not on the phone as long as I was with a Credo.
Yeah. I just feel like it takes so much time. And I did see a post on one of our Facebook groups that somebody hated doing it, and they're like, yes, I have the same doctor, it's spelled like this, it's the same meds that I've been on for 12 years. Like, it's very monotonous, it's annoying, and they're
just doing their jobs.
They are.
I mean, they don't probably even understand what it all means, but
no.
So anyway, this gets sent. I actually just got a shipment today. This is my vial of Remodulin. This is a pretty high dose. I'm on the 5 milligram vial, which I think there's only one more after this, which is the 10 milligram vial. Mm-hmm. But I've been at the same concentration for about 7 to 8 years now, which is good, but I'm terrified of the moment where I have to increase my concentration, because that just means that it's getting worse.
Maybe you won't have to.
Maybe I won't. You never know.
Think positive.
So this is the highly concentrated solution. And then this is a prostacyclin, so it vasodilates. Then I have to have my diluent. So this is just normal saline. So I dilute this with this. And these are just other supplies. I should have just showed you my package.
One that's on your side, or?
Yeah, we'll go with that. And then the tubing. So when I get my shipment, I divide and put all of my supplies into like little goodie bags. So this is my little goodie bag. Every time I go to mix, I just pull one of these. I get my medication, get my pump, and whatever else I might need.
And go back to business.
But I make sure I have alcohol swabs in there, just because if I have to grab it and go somewhere, then I have everything that I need.
Make sure you talk about your site, that you change your site, because that's super important. And people don't I don't think people realize how much goes into
I hate showers.
This. Like, this is a big deal. Big deal.
So here is the line, the insertion, and I wore a shirt that's a little easier to see. Now, when I first got my line, I didn't know how to take care of it. No one really, they told me how to take care of it. But I don't think, again, they don't live with it. So they didn't really have the hands-on experience to take care of it completely.
Yeah.
So I was given this Aquacel, which some of you might be familiar with, but it's just pretty much an adhesive cellophane, and then you stick it on top. It's supposed to be waterproof. It's not. So when I first got my line, I became septic twice very quickly. And, they're trying to figure out why. Well, I was letting it get wet and then not doing anything about it. Mm. So all this is just trial and error. So what works for me, and it may not work for everybody, and please talk to your doctor before you change anything that you're doing, but I don't cover it with the Aquacel anymore. I get in the shower, I do what I want to do, and then I just make sure I change my dressing after it gets wet. So I will not go the entire day after a shower before I change it or clean it. I was going to go somewhere with that, but
I don't know. The fact that she's non-compliant. Just kidding. She's not.
But that's worked wonders for me.
Anything that we do, you need to make sure that you're following your doctor's plan. That's one thing I think we definitely need to say is, everybody's different. We talked about that before. Everybody reacts differently to the medications. We're